I'm going to explain a little bit about parts therapy methods. Now, there's lots of different types of parts therapy methods that therapists will use. Some of the real popular ones these days would be internal family systems therapy, the structural dissociation model. One of the older ones that's still used quite a bit is the ego state therapy. And there are multiple other approaches that incorporate sort of a parts component where basically you take some process inside of you, you personify it, you treat it like it's a person or a being inside of you, and you talk to it. It's just a way to use your language system to access some of the deeper emotional content that really runs on wordless channels that continue to process below the level of rationality. It's a way of sort of injecting a greater level of consciousness into those processes. And so what I'm going to do is explain a little bit more about just how it works from a neurological perspective. The way I'm going to explain it is going to be most consistent probably with the structural dissociation model. But basically, what happens is you and me, when we have a survival drive that is thwarted, what happens is because we're adaptable beings, our nervous system sets up a process to make sure we can handle it. And so in cases of attachment rupture where you realize, oh wow, my attached drives are and my needs are not going to be met, you know, my need to connect with others as for my survival as a human, it's not going to be met right here. When that's thwarted, or when you find that to your surprise, shock, and chagrin that somebody's not trustworthy that you thought and expected to be trustworthy, or that by nature you would need to be trustworthy, yeah, your nervous system sets up a process to cope with that. All right. And similarly with trauma, a lot of times what happens is when you've had a traumatic experience and your nervous system is helping you to sort of manage a world that has become unsafe, especially if it's a cumulative trauma where you keep having traumatic experience and disappointment after traumatic experience and disappointment, what ends up happening is your body sets up multiple processes to make sure that you can stay on the adequate level of high alert that it's trained to respond with. All right. And so whether it's trauma, whether it's realizing you're in a world where you can't trust people you thought you could trust, whether it's attachment rupture where people that were close to you suddenly left, and you need to prepare yourself for that. What happens is you just have processes that develop within you to get you ready for that, to get you working toward that. And so naturally what happens is you have parts. You have processes within you that keep arising, and a lot of times they arise in situations where it's not appropriate or helpful for them to arise. So what do you do to access them? Well, you talk to them. The way that might work in practice, regardless of which model you use, is you'll be talking with your therapist. You'll be talking about this situation that just keeps coming up where you just keep feeling overly upset when somebody uses a certain set of words, or when somebody looks like they're about to leave you, or just some other situation that keeps arising like that. And what the therapist might do is say, okay, so part of you feels that way. And you can say, well, yeah, this part of me feels that way. You know, and if you want to argue with them, you might say, no, I feel this way. It's not a part of me, it's me. And so what the therapist is trying to do is they're trying to help you sort of disidentify with that part of you so that you can start to create a situation where you can have working self-compassion, where you can powerfully connect with the emotion without being overwhelmed by it anymore, and then really create a situation where you feel watched, accepted, and heard on a deep level when somebody else failed to take care of that, or when some situation failed to be adequately safe for you. And so how that might play out is, it's like, wow, every time it looks like my partner's about to leave me, I just feel so upset. I want to scream. I want to leave them first. I I sometimes get so angry that, this, that, or the other. And so then the therapist might say, okay, well, let's talk to the part that gets so upset. Can you feel some of it now? You might say yes. And if they have more of a somatic approach, like I usually do, they'll probably have you identify where the feeling arises in the body. And so you might see where it arises, or if there's a certain movement pattern that comes up, they might, have you sort of mimic the movement pattern for a while. And then they might have you talk to that part of you. So if you talk to that part of you, pretending like it's a little version of you inside of yourself, make a call out, send a request, say something like in your head of, so it sounds like you can get really upset when these things happen. You're an important part of me. Can you talk to me? And so when you make the call out, you usually get some kind of a response, either a response of, words that pop through all the way through the language system, or just a feeling. Sometimes people that were tense and didn't even notice it start to feel this deeper relaxation. They'll say, ooh, I just felt this. And sometimes they get a real resistant response, either a massive shutoff where suddenly their thoughts go blank and they get distracted, or where there's actually a hostile sort of feeling of pushback, an angry gesture, or an angry word that just pops through the language system, and so you get this angry statement coming up in your head. And if that's the case, you just take the approach where you're getting curious, you're getting responsive instead of reactive and resistant. The whole idea is to create a restoration of dynamic flow in your nervous system by experiencing a deep level of acceptance and reconnection with those parts of you. So if it's an angry response, you might do something like saying, wow, it sounds like when I talk to you, you get really angry. And so what I'm going to do is just make sure that we can work together and make sure that I'm not going to get upset with you for being here. Whatever you're trying to do to protect me, or whatever you're trying to protect inside of me, I'm going to respect that. And you might start just with that. And what ends up happening is a lot of times these angry or hostile processes within you that are hardwired to take over will back down, and you'll start collaborating with them. And the usefulness of taking this sort of parts approach is that a lot of times the behavioral control attempts that you've had that have been unsuccessful start becoming successful, because you've basically created an inner sense of self-acceptance and restoration of flow, parts working with other parts within you, processes that were blocked up and walled off, having their walls permeated, having bridges built. And that does a beautiful thing for your relationships outside of therapy. That does wonderful things, because when you get used to talking to yourself in this sort of accepting way, even with the parts that seem to be in deep conflict with you, it gets a lot easier to do that with your relationships and to invite the trust of others. And so even though to some extent it seems a little odd, and you might say, well, I came in here with anxiety or post-traumatic responses, and I'm coming out of here now with talking to myself and hallucinating little people inside me, it's actually a step up. It's actually progress.